In this video, I will tell you how an American scientist founded the basis of a highly successful therapy to treat post-traumatic stress syndrome by moving her hands back and forth in front of her patient's eyes, freeing them from the trauma, almost like magic. The technique of desensitization and reprocessing by eye movements, known as EMDR, was discovered in 1987 when the American scientist Francine Shapiro, during a walk in a park, noticed that by moving her eyes from side to side, the discomfort she experienced in the face of some unpleasant feelings diminished or disappeared. She researched this phenomenon and developed a therapeutic method based on bilateral stimulation of the cerebral hemispheres, which facilitates the processing of traumatic memories and reduces their negative impact. Rapid eye movement occurs naturally in our body during one of the phases of sleep, the rapid eye movement phase, or REM phase, in which the eyes move at high speed from one side to the other. This is also the phase in which dreams usually occur. Every night while you sleep, during the rapid eye movement phase, your brain is at work, sorting through the information it receives from inside and outside your body. According to the Adaptive Information Processing Model PAI, one of the theories on which EMDR is based, the brain processes, assimilates, and organizes information in groups of neurons that always store the same type of information. This is how memories are collected and stored in memory. All things captured by the senses, such as images, sounds, smells and tastes, body sensations, thoughts, and beliefs about any situation are stored in physical and psychological memory. Imagine a computer file. In the same way that files are classified into folders according to what each folder contains, the brain stores information in specific folders for each type of memory. The necessary condition to be able to correctly save each file is that the computer can recognize in which folder it should be stored. That is, if you are going to keep an image file, it must be able to realize that it is an image so that it can be saved in the image folder. When this mechanism works correctly, the information processing system digests new experiences. It integrates them with related information already stored in the memory networks, allowing the experience to make sense to us. What is useful is stored in a memory bank, which integrates situations, perceptions, emotions, feelings, and actions. This information is transformed into learning and becomes available to guide future experiences. The problem arises when the experience is not correctly processed because the system's classification capacity is exceeded and the event remains unprocessed. Because it cannot be processed, the event is stored erroneously. It cannot be connected to the memory network that contains the adaptive responses. The PAI model considers that negative behaviors and specific personality characteristics result from dysfunctionally stored information, whereas correctly processed and stored experiences are the basis of mental health. Being subjected to traumatic or stressful situations can cause experiences to be stored in the memory with a very high negative emotional charge, which exceeds the brain's processing capacity. This can occur in the face of violent events loaded with deep feelings of guilt, helplessness, or dissociation. A disproportionate physical and psychological response may be triggered when presented with a new situation reminiscent of that past event. These situations are often very limiting in people's daily lives. In the EMDR protocol, dysfunctionally stored information is accessed in a specific way. The natural processing process is stimulated, combining bilateral stimulation of the cerebral hemispheres with guided instructions prepared beforehand, facilitating the reinterpretation of the memory. Reprocessing allows changing the characteristics of the memory by detaching it from the emotional and sensory components. As the dysfunctional memory is transmuted into an adaptive resolution, resilience is also generated so that the person does not relapse into symptoms when exposed to a similar situation. EMDR has undergone multiple clinical studies to demonstrate its efficacy in treating children, adolescents, and adults with post-traumatic stress disorder, acute stress disorder, and trauma due to adverse childhood events. It has also been evaluated with excellent results in treating many other mental health conditions, such as depression and eating disorders. If you want to continue receiving valuable content on this or other topics, leave a comment, give me your like, and subscribe to our channel.